Welcome back to Learn with Professor Janula. If you're a nursing student, this channel is just for you. Don't forget to subscribe and hit the bell icon. Today we're learning about family planning counseling using balanced counseling strategy. So go ahead, subscribe, and let's get started. Now, let's look at the introduction to family planning counseling. Family planning counseling is a client-centered process. That means the healthcare provider focuses on the needs, choices, and concerns of the individual or couple. The main aim is to help them make informed decisions about contraception. In other words, they should clearly understand the available methods before choosing one. Counseling also helps clients choose a suitable method that matches their health condition, lifestyle, and future plans. Another important point is teaching them how to use the method correctly and consistently so that it will be effective. Most importantly, family planning counseling always emphasizes respect, privacy, and informed choice. The client should feel comfortable, respected, and free to make their own decision. Now let's see what the Balanced Counseling Strategy, or BCS, means. BCS is a structured and interactive counseling method used in family planning. It was developed to help healthcare providers give clear and organized counseling to clients. In simple words, it is like a step-by-step guide that helps nurses and doctors talk with clients in an easy and effective way. For example, instead of giving too much information all at once, the healthcare provider asks questions, understands the client's needs, and then explains only the most suitable methods. BCS helps healthcare providers give comprehensive and unbiased information. This means they explain all available methods fairly, without forcing the client to choose a particular one. For example, if a woman wants spacing between pregnancies, the nurse explains different options like condoms, pills, IUCD, or injections, including their benefits and side effects. Another important point is tailoring counseling to client needs. This means counseling is adjusted according to the person's age, health condition, family situation, and future plans. For example, a woman with hypertension may not be advised to use certain hormonal contraceptives, so another safer method may be suggested. BCS also improves method selection and continuation. When clients clearly understand how to use a method and what to expect, they are more likely to continue using it correctly. For example, if a client knows that mild spotting can happen after starting injectable contraception, she may continue using it instead of stopping out of fear. Now let's discuss the objectives of Balanced Counseling Strategy, or BCS. The first objective is to improve the quality of family planning services. This means clients should receive clear information, proper guidance, and respectful care. For example, instead of quickly prescribing a contraceptive method, the healthcare provider spends time understanding the client's needs and explaining options properly. The second objective is to ensure informed and voluntary choice. This means the client chooses the contraceptive method by their own decision after understanding all the information. Nobody should force them. For example, one woman may prefer condoms, while another may choose an IUCD, depending on their comfort and plans. Another objective is to reduce method discontinuation. Sometimes people stop using contraceptive methods because of fear, side effects, or lack of knowledge. Proper counseling helps prevent this. For example, if a woman knows that mild nausea can happen with oral pills during the first few weeks, she may continue using them instead of stopping suddenly. BCS also promotes effective contraceptive use. This means teaching clients the correct way to use the method so it works properly. For example, condoms should be used correctly during every sexual act, and pills should be taken regularly at the same time each day. Finally, BCS helps address individual health needs and preferences. Every person is different, so counseling should match their health condition, lifestyle, and future pregnancy plans. For example, a woman with diabetes or high blood pressure may need a different contraceptive method compared to someone without these conditions. Now let's look at the key features of the Balanced Counseling Strategy, or BCS. The first feature is that it is client-centered. This means the counseling mainly focuses on the client's needs, concerns, and preferences, rather than the healthcare provider's opinion. For example, if a couple wants to delay pregnancy for a few years, The provider suggests methods suitable for spacing rather than permanent methods. Another feature is the use of job aids like cards, charts, and algorithms. These tools make counseling easier to understand for both the healthcare worker and the client. For example, a chart may help compare different contraceptive methods based on effectiveness, duration, and side effects. BCS also focuses on method eligibility and preferences. This means the provider checks whether a contraceptive method is medically safe and also acceptable to the client. For example, a smoker above 35 years may not be advised to use certain hormonal pills, so another safer method may be recommended. Another important feature is two-way communication. Counseling is not just the healthcare provider talking. The client is encouraged to ask questions, share doubts, and discuss concerns openly. For example, a woman may ask whether an IUCD affects future pregnancy, and the nurse explains that fertility usually returns after removal. Finally, BCS is systematic yet flexible. It follows an organized step-by-step process, but the provider can still adjust counseling according to each client's situation. For example, counseling for a newly married couple may be different from counseling for a mother who already has 2 children. Now let's discuss the components of BCS counseling, especially the pre-choice stage. This is the first stage of counseling where the healthcare provider tries to understand the client before suggesting any contraceptive method. The first step is establishing rapport. This means building a friendly and comfortable relationship with the client so they feel free to talk openly. For example, the nurse may greet the client politely, introduce herself, and speak in a calm and respectful manner. The next step is ensuring privacy and confidentiality. Family planning is a personal topic, so the client should feel safe while discussing it. For example, counseling should happen in a private room, and the client's information should not be shared with others without permission. After that, the healthcare provider assesses different important factors. First, reproductive goals are assessed. This means understanding whether the client wants children soon, wants to delay pregnancy, or does not want more children. For example, a newly married couple may want to postpone pregnancy for a few years, while another couple may want permanent contraception after completing their family. Next is medical history. The provider checks for illnesses or conditions that may affect contraceptive choice. For example, a woman with hypertension, diabetes, or a history of blood clots may need special consideration while choosing a method. Finally, previous contraceptive use is assessed. The provider asks whether the client has used any contraceptive methods before and what their experience was. For example, if a woman stopped using pills because of side effects, another method like an IUCD or condom may be discussed. Now, let's discuss the method choice stage in BCS counseling. This is the stage where the healthcare provider explains the contraceptive methods that are suitable for the client. The provider first presents methods based on eligibility. This means only methods that are safe and appropriate for the client's health condition and needs are discussed. For example, if a woman is breastfeeding, the provider may suggest methods that are safe during breastfeeding. Next, the provider explains the effectiveness of each method. This means how well the method prevents pregnancy when used correctly. For example, an IUCD is usually more effective than condoms because it works continuously for several years. The healthcare provider also explains the advantages and disadvantages of each method. For example, birth control pills are easy to stop whenever pregnancy is desired, but they must be taken daily. On the other hand, condoms also protect against sexually transmitted infections, but they must be used correctly every time. Side effects are also discussed honestly with the client. This helps avoid fear and confusion later. For example, some women using injectable contraception may experience irregular bleeding or slight weight gain. Finally, the healthcare provider helps the client compare different options and choose the best one. The provider guides the client, but the final decision is always made by the client. For example, one client may prefer a temporary method like condoms, while another may choose a long-term method like an IUCD, depending on their lifestyle and future plans. Now let's discuss the post-choice stage in BCS counseling. This stage happens after the client has selected a contraceptive method. The main aim here is to make sure the client knows how to use the method correctly and safely. First, the healthcare provider gives detailed instructions about the selected method. For example, if the client chooses oral contraceptive pills, the nurse explains when to start the pills, how to take them daily, and what to do if one pill is missed. If the client chooses condoms, the provider explains the correct way to use and dispose of them. Next, side effects and warning signs are discussed. This is important so the client knows what is normal and when to seek medical help. For example, mild spotting or slight nausea may happen with some contraceptive methods and are usually not dangerous. But severe abdominal pain, heavy bleeding, or breathing difficulty should be reported immediately. The healthcare provider also explains the importance of follow-up visits. These visits help check whether the client is comfortable with the method and whether there are any problems. For example, a woman using an IUCD may be asked to return for a follow-up check after insertion. Finally, correct usage is reinforced again and again. This helps improve effectiveness and prevents failure of the method. For example, clients using birth control pills are reminded to take them regularly at the same time every day, while condom users are reminded to use condoms during every sexual act. Now let's look at step 1 in the balanced counseling strategy, which is greeting and needs assessment. The healthcare provider should welcome the client respectfully and make them feel comfortable. For example, speaking politely and ensuring privacy helps the client talk openly. Next, the provider asks about fertility intentions, like whether the client wants children soon, later, or not at all. They also assess spacing or limiting needs. For example, some couples may want to delay pregnancy for a few years, while others may want no more children. This helps in choosing the most suitable contraceptive method. Now, let's move to step 2, which is screening for method eligibility. In this step, the healthcare provider checks whether a contraceptive method is safe for the client. Standard guidelines like the World Health Organization medical eligibility criteria are used to help choose suitable methods. The provider also rules out contraindications, meaning health conditions that may make certain methods unsafe. For example, a woman with uncontrolled high blood pressure may not be advised to use some hormonal contraceptives. This step helps ensure the client receives a safe and appropriate contraceptive method. Now, let's look at step 3, which is providing method options. In this step, the healthcare provider explains the different types of contraceptive methods available, so the client can choose what suits them best. Natural methods include tracking safe and unsafe days during the menstrual cycle. Barrier methods like condoms prevent sperm from reaching the egg and also help protect against infections. Hormonal methods include pills, injections, and implants that prevent pregnancy using hormones. Long-acting methods like IUCDs and implants work for several years without needing daily attention. Permanent methods, such as male or female sterilization, are suitable for couples who do not want more children. The provider explains each option clearly so the client can make an informed choice. Now let's look at step 4, which is helping the client choose a method. In this step, the healthcare provider encourages the client to ask questions and clear any doubts. The provider should also respect the client's values, preferences, and lifestyle while helping them choose a method. For example, a client who wants an easy long-term option may prefer an IUCD, while someone who wants a temporary method may choose condoms or pills. The final decision should always be made by the client after understanding all the options. Now, let's look at step 5, which is method-specific counseling. In this step, the healthcare provider explains clearly how to use the selected contraceptive method and when to start using it. For example, birth control pills should be taken daily at the same time, while condoms should be used correctly during every sexual act. The provider also explains possible side effects, so the client will not become worried unnecessarily. For example, some women may experience mild nausea or irregular bleeding with hormonal methods. Finally, myths and misconceptions are addressed. For example, some people believe IUCDs cause permanent infertility, but this is not true. Proper counseling helps clear such misunderstandings. Now, let's look at step 6, which is follow-up and support. After choosing a contraceptive method, follow-up visits are important to check whether the client is comfortable and using the method correctly. The healthcare provider should also give contact information for emergencies or method-related concerns. For example, if a client experiences severe side effects or has doubts about the method, they should know whom to contact for help and guidance. Now let's discuss the tools used in Balanced Counseling Strategy, or BCS. Healthcare providers use different tools to make counseling easier and more effective. Counseling cards and method brochures help explain contraceptive methods clearly to clients. The WHO eligibility wheel helps providers check which contraceptive methods are safe for different health conditions. Flip charts and decision-making aids also help clients compare methods and understand their options better. These tools help categorize and simplify counseling, making the information easier for both the provider and the client to understand. Now, let's discuss the advantages of Balanced Counseling Strategy, or BCS. BCS improves the quality of care by giving clients clear and organized counseling. It also ensures client satisfaction because clients feel respected and involved in decision-making. Another advantage is that it reduces bias in counseling. This means the healthcare provider gives fair information about all methods without forcing any choice. BCS also enhances method continuation rates. When clients understand the method properly, they are more likely to continue using it correctly. Finally, BCS saves time in busy clinical settings because the counseling process is systematic and well organized. Next, let's discuss the role of the nurse in Balanced Counseling Strategy, or BCS. The nurse should provide accurate and clear information about family planning methods. Confidentiality is also very important. The client's personal information should be kept private. The nurse should use effective communication skills like listening carefully and speaking in a friendly and respectful way. The nurse must also respect the client's cultural beliefs and personal choices. Finally, nurses should encourage male involvement, because family planning is a shared responsibility between both partners. Now let's discuss communication skills in Balanced Counseling Strategy, or BCS. Active listening is very important. The healthcare provider should listen carefully to the client's concerns and questions. A non-judgmental attitude is also needed. The client should feel respected and not criticized for their choices. Empathy means understanding the client's feelings and situation. Simple language should be used so the client can easily understand the information. Finally, the provider should encourage client participation by asking questions and involving the client in decision-making. Now, let's discuss the limitations of Balanced Counseling Strategy, or BCS. BCS requires proper training, so healthcare providers must learn how to use the counseling approach correctly. It also needs counseling tools like cards, charts, and brochures to make the process effective. In the beginning, BCS may take more time because detailed counseling is provided to the client. Finally, the success of BCS depends on the communication skills and knowledge of the healthcare provider. Now let's discuss the ethical principles in Balanced Counseling Strategy, or BCS. Informed consent means the client should receive complete information before choosing any contraceptive method. Voluntary decision-making means the client should make the decision freely without pressure from anyone. Privacy and confidentiality are also very important. The client's personal information should be kept private. Finally, non-coercion means healthcare providers should never force or pressure clients to choose a particular method. The final choice always belongs to the client. To conclude, Balanced Counseling Strategy, or BCS, is an effective and structured approach to family planning counseling. It helps clients make informed choices by giving clear and unbiased information about contraceptive methods. BCS also improves client satisfaction and supports better health outcomes. Overall, it is an important tool for nurses and healthcare providers to provide quality family planning services. That's the end of this video. If you liked this video, don't forget to like, share, and subscribe to my channel for more nursing learning videos. Thank you for watching, and keep learning.